Ever woken up at exactly 3:17 a.m., pulse racing, toes freezing against the floor, sprinting toward the bathroom like it's the final lap of the Olympic 400-meter dash? Now multiply that frantic shuffle by 3 times every night, 365 nights a year. That's more than 1,000 midnight marathons stealing away deep sleep healing, immune repair, and dream-powered memory consolidation. If you're over 60 and nodding right now, the stakes are brutally real. Chronic night waking increases fall risk, blood pressure spikes, weight gain, and even dementia. Tonight's mission is simple but vital. Discover why your bladder behaves like an overeager puppy at the worst possible hour, and map the science-backed steps to reclaim peace between the sheets. We'll meet real patients, like 74-year-old Mrs. Alvarez, who fractured her hip during a 2 a.m. dash, and we'll test myths from just drink less water to it's inevitable with age. Spoiler, biology, environment, and lifestyle dance together in this nightly symphony, but you conduct the orchestra. Stick around because by the end of our journey, you'll not only understand the hormonal seesaw inside your kidneys, but also hold an actionable blueprint to reduce bathroom trips by up to 50% in 4 weeks. That's the difference between drifting into restorative REM and stumbling through foggy mornings. Ready to swap panic padding for pillow paradise? Let's flush the confusion, pun absolutely intended, and start where every great medical detective story begins, with a curious mind and a clear, pressing question. Because make no mistake, those interruptions sap comfort and secretly accelerate cardiovascular strain, spike cortisol, and raise dementia risk. Imagine shaving years off your health span simply by sprinting in the dark. That's why you must lean in and share this episode widely, and keep a notebook ready tonight, handy. Welcome to Active Aging, the channel where wrinkles are merely laugh lines in progress, and every episode is a masterclass in living longer, stronger, and sharper. I'm Dr. Goodwell, internist, nutrition researcher, and recovering dad joke addict. Think of me as the professor who sneaks fries off your plate while simultaneously lowering your cholesterol. Sound impossible? Stick around. Before we deep dive into tonight's topic of nocturia, here's the promised 30-second orientation. Active aging exists because modern medicine's greatest challenge isn't merely extending lifespan, it's extending health span. The years when you can sprint upstairs, remember birthdays, and dance at weddings without wondering whether your hip will send a formal complaint. Every episode distills peer-reviewed science into practical steps that genuinely work in real people, not lab mice. Now, back to that pesky 2 a.m. wake-up call. The official Latin moniker is nocturia, defined as waking from sleep 1 or more times to urinate. But for caregivers and older adults, it usually translates to lost dreams, cranky mornings, and an elevated risk of tumbles. Worldwide, roughly 50% of people over 60 wrestle with nocturia, yet many shrug it off as just aging. Spoiler, you don't have to accept it. In the next 13 segments, we'll decode hormones, hydration, comorbidities, and high-tech gadgets, weaving in stories and visuals faster than you can say anti-diuretic hormone. We'll test myths. Does drinking less fix everything? Usually not. We'll highlight potential landmines. Can certain blood pressure pills trigger nighttime waterfalls? Absolutely. And of course, we'll sprinkle humor, because bladder talk shouldn't be painfully dry. Take a breath, adjust your headphones, and keep an open notebook. Your transformation from bleary-eyed bathroom sprinter to rested Renaissance elder starts right now. Before we dissect causes, we need crisp definitions because language shapes diagnosis. Nocturia is waking from sleep to urinate at least once. Clinically significant nocturia usually begins at 2 or more nightly awakenings. Yet numbers don't tell the full story. If a single episode leaves you staring at the ceiling for an hour, that lone trip can sabotage cognition and mood as much as 3 quick visits. Definition therefore includes the impact on daytime function. Quick recap. Our stakes are disrupted sleep, fall danger, and hidden pathology. To keep our knowledge chain strong, let's plant the first stepping stone, the kidney's circadian rhythm. Deep in your brain, the suprachiasmatic nucleus signals the pituitary to release antidiuretic hormone, ADH, more heavily at night. ADH tells kidney tubules, hold on to water, we're resting. Consequently, nighttime urine output naturally drops by about 50%, allowing sleepers to dream undisturbed. In elders, ADH production often wanes or the kidneys ignore its whisper. Result? Nighttime polyuria and the dreaded stumble. Visualize this with animation. Sun setting, pituitary glowing, kidneys shrinking a water faucet. Then, as age advances, the faucet reopens under moonlight. That image cements our first concept: hormonal timing failure. But hormones are only one domino. Next, we'll zoom out from internal biochemistry to external triggers: beverages, salt, and the so-called harmless afternoon coffee that might be sabotaging your REM. For now, jot a note. Define your own nighttime volume objective. Understanding ADH is foundational. Without it, every subsequent fix is guesswork. Grab a calibrated jug tomorrow and measure total urine after 10 p.m. If you're producing more than 1/3 of your 24-hour volume during sleep, experts dub that nocturnal polyuria, a treatable condition. Time to raid the kitchen. Many elders heroically hydrate in the late afternoon to reach the mythical 8-glass quota, then cap dinner with decaf coffee or a soothing herbal tea. Surprise! Commercial decaf retains up to 15% of its original caffeine, and many herbal blends include hidden diuretics like hibiscus. Alcohol throws another wrench by suppressing ADH temporarily. When its effect rebounds at 3 a.m., your kidneys unleash a watery torrent. Even a glass of wine at 7 p.m. can echo hours later. Salt deserves equal scrutiny. Sodium is the Pied Piper of water, pulling fluid into the bloodstream and driving higher blood pressure. The body must offload that excess volume eventually, and if evening meals resemble a tapas board salt mine, the offload happens at night. Japanese researchers showed that simply cutting evening sodium by 30% reduced nocturia episodes from an average of 2.3 to 1.1 in 4 weeks. That's not a tranquilizer, that's table spice discipline. Let's paint the picture. Animated salt crystals marching across a dinner plate, whistling as water molecules follow like mesmerized mice straight to the bladder. Replace that soundtrack with a quieter scene: rosemary, basil, and citrus zest dancing instead. Fewer crystals, fewer trips. Caffeine's story is equally animated. It not only increases filtration but irritates bladder muscle, causing urgency even with small volumes. Show a side-by-side graphic: calm bladder after water versus jittery bladder after coffee. Action time: starting tomorrow, shift 2/3 of daily fluid to before 3 p.m., switch evening beverages to warm water or golden milk, and season food with herbs rather than salt. Track 1 week. If bathroom sorties drop, you've nailed an external trigger. Up next, Segment 05 exposes internal medical villains orchestrating your nocturnal water ballet. Now let's unmask the internal conspirators. First on stage, obstructive sleep apnea. Every apnea episode is like a micro-drowning. Oxygen dips, the heart panics, and it releases atrial natriuretic peptide yelling, "Dump sodium now!" Kidneys obey, producing extra urine that floods your slumber. Treat apnea with a well-fitted CPAP and nighttime trips can plummet 40% within 2 weeks. Next culprit: diabetes in its 2 notorious forms. Poorly controlled type 2 drags water through renal tubules via osmosis. Result: high-volume sugary urine demanding exit. Meanwhile, diabetes insipidus, a truly underdiagnosed condition, stems from ADH shortage or resistance. Sugar isn't the driver, hormones are. Men, brace yourselves. Benign prostatic hyperplasia enlarges tissue around the urethra like a swelling hose nozzle. The bladder overcontracts, signaling urgency long before full. Women aren't exempt. Estrogen decline weakens pelvic support, multiplying urgency. Heart failure corners both sexes. Daytime ankle swelling signals fluid pooling. Lie down and gravity vanishes. Fluid returns to circulation. Kidneys excrete. Cue midnight flood. Hypertension increases filtration pressure, priming nocturia. Mini-story: Mr. Patel, 68, blamed small bladder genes. A sleep study uncovered severe apnea. CPAP plus weight loss cut his nightly trips from 5 to 1. Morale: verify, don't guess. Diagnostic pearl: if nocturnal output exceeds 1/3 of total urine and daytime leg swelling is present, suspect cardiac contribution. Next, we will teach documentation to reveal which culprit plays lead in your saga. Great detectives keep meticulous field notes, and conquering nocturia is no different. Your first tool is the frequency volume chart. For 72 hours, record every void: time, measured volume, and an urgency score from 1, casual pit stop, to 5, red alert sprint. Patients often overestimate intake and underestimate output. The chart smashes this illusion. Next, Pair it with a sleep diary. Log bedtime, wake times, caffeine, alcohol, naps, and evening medications. Combining these records creates a heat map of triggers. Print the summary and tape it to your fridge so household members can cheer you on or gently confiscate late-night cola. Laboratory groundwork follows. Standard panels include fasting glucose, HbA1c, electrolytes, kidney function, and for men, PSA. Elevated calcium may hint at hyperparathyroidism. Low iron can coexist with restless legs masquerading as urgency. Holter monitoring or natriuretic peptide tests expose hidden heart failure. For the sleep angle, home pulse oximetry offers a budget apnea screen. Desaturation below 90% signals need for polysomnography. Women with pelvic concerns may require urogynecology evaluation and bladder ultrasound. Finally, share the entire dossier with your clinician, not scattered anecdotes. A documented pattern often shortens the road to correct treatment by months. Bonus tip: snap smartphone photos of swollen ankles or CPAP readouts and staple them digitally to your diary. Visuals speak 1,000 milliliters. Now let's convert data into lifestyle interventions, the low-risk, high-impact wins forming the backbone of real-world success. Data in hand, we pivot to lifestyle, the realm where small tweaks create outsized dividends. Start with fluid timing. Aim to consume 60% of liquids before 3 p.m., 25% between 3 and 6, and only 15% afterward. Finished trials showed this shift alone halved nocturia in adults over 65. Declare an evening salt embargo. Fewer than 2 grams after 6 p.m. Replace chips with unsalted nuts and lavish herbs on dinner. Exercise is mandatory. 30 minutes of brisk walking or gentle cycling late afternoon activates the calf muscle pump, flushing pooled leg fluid while you're still upright. Add 10 minutes of leg elevation, 2 pillows under ankles, while reading. Thermographic images prove swelling retreats. Bladder training adds leverage. During the day, delay urination 5 minutes when urgency strikes, gradually extending to 15. This conditions detrusor muscles and brain pathways. Layer pelvic floor exercises, Kegels for both sexes, strengthening the urethral guard. Nutrition tweaks matter. Magnesium-rich dinners, quinoa, spinach, seeds, relax smooth muscle and may boost bladder capacity. Stick to complex carbs and slow-digesting protein at night to steady glucose. Roller coaster spikes equal osmotic diuresis. Commit these habits to a one-page checklist taped near the toothbrush. Each ticked box votes for uninterrupted sleep. Finally, recruit a hydration buddy or use a phone reminder app. Social accountability triples adherence rates in real-world documented geriatric cohorts. In segment 08, we'll spotlight targeted foods and supplements that amplify these behavioral foundations. Nutrition often plays understudy in bladder discussions, yet the right menu can transform nights. First, tart cherry juice. Rich in natural melatonin and anthocyanins, a standardized 240 milliliter lunchtime serving lengthened sleep 84 minutes in older adults during a Louisiana trial. Keyword: lunchtime, nighttime sugar surges sabotage. Second, pumpkin seed extract. Randomized studies show 500 milligrams daily reduced nocturia in both men and women within 6 weeks, likely by relaxing bladder muscle. Magnesium earns third billing. Surveys reveal 60% of seniors run marginally deficient. Magnesium relaxes smooth muscle and supports circadian rhythms. Add greens, almonds, or a 200 milliliters glycinate supplement. Beta-cytosterol from saw palmetto berries, famed for prostate health, can also reduce urgency in women by modulating inflammation. Dose 160 milliliters twice daily. Kiwi fruit with skin offers serotonin precursors plus fiber. 2 kiwi an hour before bed sped sleep onset in Taiwanese studies. Pair with protein to curb sugar rush. Show a playful animation of a kiwi wearing pajamas waving goodnight to a bladder icon. Hydration hack. Golden milk made with turmeric and black pepper delivers warmth and anti-inflammatory perks without caffeine. Add cinnamon for glucose control and bedtime signals. Action plan. Pick one nutrient strategy this week, track results, then layer another. Keep variables isolated. You're running N-Nature1 research. As always, consult your clinician before adding supplements, especially if you're juggling anticoagulants or kidney concerns. Let's elevate the conversation to pharmaceuticals when nutrition and behavior still leave you pacing halls. Sometimes the body ignores gentle nudges and demands pharmacologic persuasion. Enter the medication toolkit. Antimuscarinics such as oxybutynin and tolterodine block M3 receptors on detrusor muscle, reducing spasms. Downside: dry mouth, constipation, and memory fog. If crossword puzzles already feel tricky, consider beta-3 agonists like mirabegron. By relaxing bladder walls without crossing the blood-brain barrier, mirabegron preserves cognition but may raise blood pressure. Monitor weekly. For those producing Niagara volumes, desmopressin steps in. A synthetic twin of ADH, it instructs kidneys to concentrate urine. Start low, 25 mcg sublingual for women, 50 mcg for men, and recheck sodium at 3, 7, and 30 days. Hyponatremia can surprise even seasoned clinicians. Alpha blockers such as tamsulosin target prostate obstruction, widening the urethral lane. Larger glands may need 5-alpha reductase inhibitors like finasteride. Combine with alpha blockers for synchronized relief, but watch dizziness and libido. Emerging agent Vibegron offers similar benefits with fewer hypertension spikes. Trials explore cannabinoids for neuropathic signaling, though legality and dosing remain wild frontiers. Medication choice is never one size fits all. A structured 4 to 6 week trial with diary metrics prevents polypharmacy chaos. Maintain a side effect checklist and review during follow-ups. Showcase a flowchart, symptom type, urine volume, recommended drug families. Crucially, drugs complement lifestyle, not replace it. A perfect pill cannot outrun late-night cola or untreated sleep apnea. Ask for a review of diuretics and nighttime antihypertensives, possibly undermining progress. Let's examine procedural options when even pharmaceuticals surrender. For a subset of warriors, structural roadblocks remain after lifestyle and medications fire every salvo. Modern surgery offers minimally invasive routes to serenity. Men first, transurethral resection of the prostate, TURP, shaves excess tissue like a landscaper trimming a hedge. Newer office-based options, such as Urolift implants or Resume water vapor therapy, PROP open the urethra with minimal downtime. Preserved sexual function and same-day discharge make them attractive. Women face different mechanics. Significant pelvic organ prolapse can kink the urethra. A mid-urethral sling, placed via small incisions, acts like a supportive hammock. For non-surgical aid, silicone pessaries lift organs and often cut nocturia by one trip nightly. Neuromodulation enters sci-fi territory. Posterior tibial nerve stimulation, acupuncture meets electricity, delivers weekly 30-minute pulses near the ankle, calming bladder reflex arcs. 60% report meaningful reduction after 12 sessions. Sacral nerve stimulators implant a pacemaker-like device in the lower back. Battery life 5 years. In refractory overactive bladder, botulinum toxin injected into detrusor offers a 6-month vacation from urgency. Same toxin that smooths wrinkles can smooth muscle contractions. Visualization: traffic jam cleared by a bulldozer, TURP, versus a barking dog calmed by gentle music, neuromodulation. Technology scales intervention to problem intensity. Remember, procedures demand shared decision-making and realistic expectations. Use validated scores like IPSS or ICIQ. Verify surgeon experience and ask about same-day catheter removal protocols. Time to shift focus from anatomy to environment, lighting, temperature, and ergonomics to keep you upright between mattress and toilet. Even the best bladder plan can be undone by a treacherous hallway. Environmental tweaks turn fracture zones into safe passageways. Start with lighting. Replace blinding bulbs with motion-activated warm LED strips along floorboards. They preserve melatonin while cutting falls by 60% in assisted living trials. Inside the bathroom, install a soft nightlight at knee height. No more fumbling. Next, analyze bed height. The ideal distance from mattress to floor matches the length of your shin, allowing a swift sit to stand without momentum or dizziness. Floor hazards lurk silently. Remove loose rugs or secure them with non-slip backing. Clear cords that masquerade as serpents across carpet. For the visually impaired, contrasting tape on door frames improves depth perception. Temperature matters. A chilly bedroom below 18 degrees Celsius can trigger detrusor instability, while an overheated one disrupts REM. Aim for 21 degrees and breathable bedding. White noise machines mask creaks that might prematurely rouse a half-filled bladder. A bedside clock with red digits avoids blue light stimulation. Emergency equipment, flashlight, non-slip slippers, and for severe mobility issues, a bedside commode or urinal funnel. Pride heals slower than hips. Show animation of a character swiveling safely from bed to commode versus wobbling down a dark corridor. Technology helps. Smart systems automate pathway lighting, and pressure sensors in mattress pads alert caregivers if a senior stays out of bed too long. Place grab bars near the toilet. Now let's synthesize threads and reveal nocturia as a barometer of biological aging. We've marched through hormones, habits, hardware, and home design, but let's zoom out. Nocturia is a nightly report card on systemic aging. Each interrupted sleep cycle deprives your brain's glymphatic system of time to clear metabolic waste like beta amyloid, accelerating cognitive decline. Abrupt awakenings spike cortisol, raising blood pressure and insulin resistance. Over time, inflammation simmers, telomeres fray, and fracture risk skyrockets. In other words, every midnight trip is a tiny rehearsal for chronic disease. Mrs. Alvarez's hip fracture was Act 1. Swedish studies show seniors with untreated nocturia have a 42% higher risk of depression within 3 years. Flip the perspective. Reducing nocturia means more consolidated slow-wave sleep, turbocharging growth hormone release that repairs tissue, balances appetite hormones, and lengthens telomeres. Imagine an iceberg. Visible tip, bathroom visits, submerged mass, neurodegeneration, metabolic syndrome, cardiovascular strain. As interventions chip away at nocturia, deeper risks melt. Empowering twist. Most factors are modifiable. Treat sleep apnea, manage sugars, shift salt, strengthen pelvic floors, upgrade lighting, and consult surgeons when needed. Nocturia becomes a dashboard light, not destiny. Because let's face it, nobody includes perpetual bathroom pilgrimages in a retirement bucket list. Yet everyone includes sharp mind and sturdy bones, and restful, joyous nights. Take 60 seconds to absorb that revelation. By defending sleep, you defend future independence. Let's convert insight into a step-by-step action blueprint. You're ready for the master plan, a prioritized blueprint to reclaim sleep. Step 1. Diagnostics. Complete a 3-day frequency volume chart and sleep diary. Hand copies to your physician and urologist. Ask, do my numbers suggest nocturnal polyuria, overactive bladder, or obstruction? Step 2. Quick wins. Tonight, front-load fluids, enforce a post-dinner salt embargo, double void before bed, elevate legs at 5 p.m., and perform 5 pelvic floor contractions. Step 3. Nutritional reinforcement. Eat a magnesium-rich dinner, salmon, spinach, quinoa, and take pumpkin seed extract at dusk. If constipated, add 20 grams of soluble fiber. Straining irritates pelvic nerves. Step 4. Medical escalation. If volumes stay high, discuss desmopressin or mirabegron. Men with obstruction evaluate alpha blockers. Women with stress leakage consider a sling consult. Step 5. Environmental fortification. Install motion lights, clear pathways, add grab bars, and keep bedroom temperature at 21 degrees. Optional tech. A wearable ring tracking heart rate variability confirms sleep gains. Step 6. Accountability. Schedule 2- and 6-week check-ins to reassess progress. Invite a sleep sponsor to cheer victories and spot slips. Use a 1-page tracker logging nightly trips, hours slept, energy rating, and falls. Watch the graph descend and celebrate each tick. Remember, the blueprint is iterative. Adjust fluid timing or meds based on feedback. Savor incremental victories. Science shows consistent small gains sustain motivation better than massive overnight change. Plug these steps into your phone reminders so none slip through cracks. Time to peek into near-future innovations that may render nocturia medical history. Science rarely naps, and researchers are engineering tomorrow's toolkit. Highlight 1. Nanoparticle ADH delivery. Stanford labs encase desmopressin in lipid shells releasing over 8 hours, sustaining urine concentration without sodium dips. Human trials start next year. Second, smart textiles. European engineers weave capacitive threads into mattress covers that map bladder fullness via impedance. When threshold nears, the fabric vibrates, waking sleepers before desperation sets in. Pharmaceutical horizon, aquaporin 2 modulators promise fine-tuned water reabsorption without systemic hormones. Phase I results show 50% urine reduction with negligible blood pressure impact. Bioelectronic medicine joins, Injectable neuromodulators, grain-sized, sit near pudendal nerves, powered wirelessly as you walk. Artificial intelligence crunches hydration logs and ambient data to push personalized cutoff alerts to your watch. Imagine a mini Dr. Goodwell popping up at 5 p.m. saying, "Sip slower, champ." Supplement pipeline. Fluorotannin from brown seaweed downregulates bladder cytokines in rodents. Clinical translation is distant but colorful. Public health policy wakes up too. Japanese hospitals now screen inpatients for nocturia risk, preventing falls. Expect some innovations within 5 years. Others may cycle through setbacks, but momentum is undeniable. And yes, humor will travel alongside progress. Congratulations, sleep seeker. You've navigated hormones, hydration, hardware, and futuristic hope. Now anchor that knowledge with decisive action and community support. Tonight, draft your personal night restoration plan. List 3 quick wins: hydration pyramid, ankle pumps, bedside lighting. Add 1 medium-term target like scheduling a sleep study or pelvic floor consult. Finally, write a moonshot aspiration, slashing nightly trips to 1 or fewer. Pin the plan where your toothbrush lives. Next, share your top challenge or victory in the comments. Did delaying afternoon tea cut a bathroom visit? Did CPAP magic have output? Our active aging squad cross-pollinates ideas faster than fruit flies in a banana stand. I read every comment and may feature your story in a future episode. Fame and a healthier bladder 2 for 1. While your keyboard is warm, hit subscribe and ring the bell. Upcoming episodes tackle reversing sarcopenia, decoding vitamin D myths, and building a ridiculously resilient immune system. You don't want to miss them. Just science and snark. Quick disclaimer: none replaces individualized medical advice. Bring your plan to a qualified clinician, preferably one who knows what a meme is, and tailor strategies to your profile. Shut down autoplay, dim the lights, and prepare to sleep like your bladder owes you interest. Until next time, I'm Dr. Goodwell reminding you, age is inevitable, but nocturnal sprinting is negotiable. Good night, hydrated heroes. If you found value, forward this episode to a friend who keeps blaming the cat for nightly wake-ups. Tag me with active aging sleep wins and show off your frequency volume charts. Yes, nerdy data can trend. Let's start a ripple.